morning, everyone. Welcome to Making Milestones. This is episode 7 of Making Milestones, and today we're going to be discussing 8 fundamentals of the Doman Method. So I'm going to be talking about what are the most important elements of the Doman Method, and specifically about the Doman Method approach to helping kids with special needs. I'm also going to be talking about how the Doman Method differs from other approaches out there. So give me 1 second to share my presentation and we will get started. And here we are. All right. So Making Milestones is a web series to help families of kids with special needs achieve the impossible. I am your host, Spencer Doman. I'm the Chief Innovation Officer for Doman International. Doman International is a nonprofit organization that empowers families of kids with special needs in the wellness of their child. We coach parents how they can help their children in the best possible way so that their kids can reach their fullest potential in life. So when talking about the Doman Method, we really have to start with the story of my grandfather, Glenn Doman, who created the Doman Method. So my grandfather was trained as a physical therapist, but he realized that as he worked with patients who had had brain injuries, that the conventional therapies that he had learned in school, that he was trying out with them, was not getting results. And so this really started him on a lifelong journey toward getting results. How could he help his patients with brain injury, with developmental delays, with special needs to get the best possible results? And so he designed new treatments and programs. And even more interestingly, after he designed these new programs, he found he got even better results when he taught parents how to do these programs with their children. And so we're going to talk a lot in this presentation about why it is in the Doman Method we teach parents how to do the treatment themselves. One essential part of how the Doman Method differs from so many other approaches is that it is designed to improve brain development and function. When you look at the different children that can be helped by the Doman Method, they might come with a wide variety of diagnoses. We're talking about kids that might have been diagnosed with autism, ADD or ADHD, cerebral palsy, brain injury, learning difficulties, epilepsy, developmental delay, Down syndrome, and a host of other genetic abnormalities. And so the Doman Method can help children with any kind of neurodevelopmental delay. That's a delay that comes from a lack of brain development or maturity. And so what Glenn realized, and this was maybe his first brilliant discovery, is that so many of the treatments that existed were focused on the symptoms rather than treating the underlying cause of the problem that the patient was facing, right? So he saw that, for example, a patient would come to him and the child didn't speak well, so the child was in speech therapy. And the child didn't move well, so that the child was in physical therapy. And they didn't use their hands well, and so they were in occupational therapy. But when he observed what was happening with those children in the therapies, the approaches were very symptom focused, right? They were focusing on trying to get the child to move their arm more, right? Or trying to get them to use their mouths to speak. And what he really realized and taught the world is that the problem isn't in the arms or in the legs or the hands or the mouth. The problem is in the brain. And so any treatment that's going to help that child has to be brain focused. It has to be focused at helping the brain develop. This is a phenomenon now known as neuroplasticity. When he started this work, neuroplasticity wasn't a well-known word. but he essentially discovered with his patients that the brain has the ability to develop more quickly if you do the right kinds of stimulation and if you do the right kinds of activities with the child. And so that's what the Doman method is all about. It's about giving stimulation that helps the brain develop better, and then giving a child opportunities that they may not have had otherwise to help the brain develop better. And so when you treat the problem, right, the underlying cause, then the symptoms start to go away. So that's what we see day in and day out with the Doman method. When we treat the underlying cause, which is in the brain, and the brain is the command center of the body, then the symptoms can start to go away. So the child might start to speak, might start to use their hands better, they might begin to walk, because we're actually treating the root cause of the problem. To understand how crazy the idea is to treat symptoms rather than the problem, imagine if you went to a doctor and you said to the doctor, "Doctor, something's wrong. I've got terrible chest pains, the worst chest pains I've ever experienced. And my left arm has gone numb. I can't feel it. And I feel incredibly nauseous and sick. What's going on?" A good doctor will figure out the underlying cause of the problem, right? That doctor would say, "It sounds to me from those symptoms that you're having a heart attack and we need to treat the heart immediately." A bad doctor would try to treat the symptoms, right? That doctor might say, "Okay, you're dealing with chest pains, so I'm going to give you a painkiller. And you're not feeling your left arm, so I'm going to massage your left arm until you feel it again. And you're feeling nauseous, so let me give you anti-nausea medication." That's a treating the symptoms approach. And as we know, the patient would die if a doctor took that approach. So this is why it's so important to understand, why does the child have a problem? And then how are we going to treat the underlying problem to get rid of the symptoms? And that's what the Doman method is all about. So my grandfather Glenn did not choose the name Doman method. In fact, he didn't really like to be recognized in that way. But we use the term Doman method really as a way of acknowledging his discoveries. He didn't choose the name. It was really the parents who were helped by his programs that created that name, and we use it in honor of him. And probably Glenn Doman is best known for writing best-selling books about child development, which has been used by millions of parents over the past decades. So let's get into those 8 fundamentals of the Doman method, how it differs from so many other treatments. Well, first of all, it's a home-based treatment. So the Doman method is done at home with family and child together. It is not an inpatient program. So sometimes a parent will say to me, "Spencer, I want my child to have the very best treatment. What clinic can I bring my child to?" And Doman International does have locations around the world, but the treatment itself is done in the home between family and child. Why do we do this? Well, first of all, no one loves a child more than their parents, right? And no one is more devoted to a child than their parents. No one has more time to give a child than their parents. So empowering the family, the people who are with the child the most, to do the program with their child is the best way to achieve major results. Even if you happen to live close to where I am and you brought your child to me 2 times a week for 30 minutes, right, which is maybe the typical amount of time therapy a kid might get, how could I really achieve major results in an hour a week with the child with very severe issues? So what we found is that the way to help these kids is by doing the program intensively. And the best way to do the program and to do it intensively is by doing it at home. And so that was really after the concept of treating the brain with neuroplasticity, I would say the second paradigm shift of the Doman method was teaching the parents to do the program at home. That was the second element which made this program so successful. The second fundamental is it is an integrative approach. You know, so often when parents are seeking help for their kids with special needs, they have to go to different professionals for different things, right? So maybe they go to a nutritionist for nutrition, and they go to a speech therapist for speech, and a physical therapist for physical development. But there's really no team overlooking the child, right? And the parents are completely reliant on the expertise of the professionals that they're going to. And unfortunately, most parents figure out the hard way that a lot of professionals don't know what they're doing. So the Doman method, on the other hand, is an integrative approach. It includes a nutrition program. It includes a cognitive development program, which includes sensory stimulation, intellectual stimulation, and speech enhancement. It includes physical development, so improving a child's mobility and manual function. And lastly, it includes respiratory development, because one of the crucial discoveries of the Doman method has been the importance of brain oxygenation. And so there is a Doman method oxygenation program, which has been created to help increase oxygen delivery to the brain. And so this is an integrative approach. It's not just about doing one thing to help a child. It's about saying, okay, what are the different treatments that a child needs together to achieve the very best results, to get that optimal neuroplasticity. The next important thing about the Doman method is it's a holistic drug-free approach. So with this, we mean we do not use medications, right, to treat problems. Medications often come with a whole host of side effects. And so very often in the world of kids with special needs, when they go to professionals, they are just told to take medication, right? Child is hyperactive, parents are told, give this medication for hyperactivity. Child has seizures, they're told, give this medication. And in the Doman method, we are a holistic approach. We try to treat a child using stimulation and activities which don't have side effects or are as safe as possible. And so, of course, there are times when medication is absolutely necessary. There are times where surgery might be absolutely necessary. And so I would never want to say that these things don't have importance. They have great importance in certain situations. But very often kids with special needs are over-medicated, sometimes prescribed medications that they don't need, or they have an underlying issue that could be treated without medications. And that's really the most important thing. When are medications not needed, and when could a holistic approach be used instead of that? And so I want to make it absolutely clear, if a child is on medication, we do not simply remove a child from their medication. That would be dangerous. And so if there are any parents out there listening to this, please don't take this as medical advice. We have physicians around the world who work for Doman International. And whenever we decide that a child no longer needs a medication, that physician will create a specific plan for reducing that medication for the child. Doing anything else besides that would be highly irresponsible. So please, if you're watching this, don't take this as an instruction to not give your child your medication. Just the opposite. Follow the recommendations of your doctors at home. But when your child begins on the Doman method, and once you begin our program and you start consulting with our staff, we have physicians who can overlook your child's medications and help you with that process. So that is why I say the Doman method is a holistic drug-free approach. We do use vitamins and supplements, which are relatively safe and very rarely include any kind of side effects, but those are really used to help optimize the function of the brain and the human body. The next thing about the Doman method, the next fundamental, it is parent empowering. We aren't just about teaching parents what to do. We're about encouraging parents, supporting them, and empowering them with knowledge and tools so that they can know how to help their child. And so that's why many parents that learn about the Doman method will very proudly kind of call themselves Doman parents. They see themselves as a part of a tribe, a certain mentality toward helping their child reach their goals in life. So the next thing that differs the Doman method from so many other approaches is it sets really high goals for our children. Very often parents are surprised when they hear us say that at Doman International, our goal for every child is wellness. And do we achieve that with every child? Absolutely not. But my grandfather, Glenn, set a very important precedent in place by telling all of us, by teaching all of us, that we must set our goals high. So often in the world of kids with special needs, professionals really don't have high goals, or sometimes they really don't have goals at all. And so setting the goals high is an important accountability factor for our team to make sure that we're doing everything that we can for a child. And so we set high goals for children. We don't lie and say that's not the case. We are passionate about our high goals. And that's why our program often attracts those kinds of warrior parents, the parents who are looking actively for answers for their kids and who want to achieve major results for our children. And so because we set high goals, this is an intensive program. I don't want to make any qualms about it. This is an intensive program. And again, that's why, the kinds of parents that come to learn about the Doman method tend to be holistic, focused parents who want holistic answers. They tend to be warrior parents, like nothing will stop them from getting answers for their kids. And they also are parents who believe in their children, who say that they believe, they know that their child can reach a higher potential in life than what the world is telling them. Now, I think one thing that surprises parents, many parents know that the Doman method is intensive, right? It's often what parents hear first about our program. But what they don't know is actually it is flexible. And this is an important thing to understand because sometimes parents, when they hear the word intensive, they get a little intimidated because they think, ooh, intensive means hard. And I don't know if I can do hard. I have enough difficulty in my life, which is true. But the Doman method is flexible. So if parents, for example, take the online Doman method course from special needs to wellness, which is our first online course for parents of kids with special needs to learn about our holistic approach, they realize pretty quickly that with the Doman method, they can take what they want from the program. So if they just wanted to do one activity that we teach them, they could do one activity. If they wanted to do two, they could do two. If they wanted to do three, they could do three. And if they want to do all of them, they can do all of them. And so that's really one of the wonderful things. What we say to parents is, it's not always so much about how much you do. It's about how consistently you do the program. So even if you took one thing from the online Doman method course and you did it consistently, you would see progress. And so this is actually a flexible program. And so if you are unsure if you can do the intensity of the program, don't allow that to stop you from learning more. In fact, just the opposite. Taking the online course will allow you to get started with things that you feel comfortable with, and then possibly even build from there. The Doman method also is historic, but also it's brand new in this sense. It really started with my grandfather, Glenn, in the 1950s. And so it's been around for 6 decades. But the Doman method is also about innovation, about creating new programs to get results with kids with special needs, and also to kind of look around the world and see what else is out there that we could use in the Doman method to get results. And so, for example, even if I look at the last 2 or 3 years, some of the best things that we've added to the Doman method were not things that we created. They were things that were discovered by other professionals, but fortunately, those professionals have made the information accessible, and so we were able to incorporate it into our program. And so in that way, the Doman method is constantly changing. That's what my grandfather Glenn taught me. He said the only thing that should be constant is change. And so we are constantly adapting our program. We're adding new things as we discover them. And if something isn't working well enough, we get rid of it. It's very important to not be dogmatic, right? To think, oh, my approach is the best approach. It's all about results. And so whatever gets the best results, we will do it. So if you'd like to learn more about the Doman method, I'd like to take 1 minute now just to go over some next steps for you. So first of all, if you want to learn more about the Doman method, contact Doman International to discuss your child and the next steps. We can help answer your questions and kind of guide you to the next step. The next thing would be to attend our online course, which is called the Doman Method from Special Needs to Wellness. And I'll tell you a bit more about this course in just a second. And while you attend that course, you can begin the Doman Method program at home using the information from the course. If you go to our website, domaninternational.org, you can fill out a contact form. You can click the contact button and fill out the form, and one of our worldwide representatives in your area will get in contact with you. I'd like to tell you about the online Doman Method course. It is a 4-week course, and in the first week, we teach about the foundations of the Doman Method. We teach about neuroplasticity and about the most important things you need to know about child development. We teach you how to evaluate your child using the developmental profile. This is a developmental chart created by my grandfather, Glenn, which is used to measure a child's development and track their milestones, and the most important milestones. And so understanding your child's development is essential to making the course a success. And so we guide you with the process of how to measure your child's development. It allows you to see where your child's strengths are, where their needs are, and then we can start to design a treatment program for your kid. In the second week, we get started with teaching you about the motor and cognitive development programs. So we teach both mobility programs for kids who can walk and who can't walk. How do we help those kids achieve the next level of mobility? How do we get them moving in a better and more coordinated way? We also talk about cognitive development. So how do we improve a child's intellectual ability? How do we improve our communication with the child? And how do we improve reading ability? In the third week, we get into sensory integration. What are the best techniques for improving vision, right? The ability to see, hearing, and tactility, the ability to feel. So we teach you about an intensive sensory program that can be used to help a child improve in their sensory areas. We also teach about nutrition and the importance of diet for kids with special needs and how to implement the ideal diet for your child. Also, in that third week, we get into the Doman Method oxygenation program about how we can improve brain function through increasing oxygenation. In the fourth and final week of the course, each participant gets a one-on-one coaching session with a staff coach at Doman International. We discuss your child's future program. We design it with you. We answer any questions that you have so that you will leave the course with a full plan for your kid, knowing exactly what you're going to do. By the way, that plan also includes a build-up plan. So we tell you how to start things, when to start things, and how much to do. So you have everything detailed for you so you can have the greatest success. The course includes 25 hours of teaching from the experts in the Doman Method. Every family is assigned a staff coach who answers their questions throughout the experience of the course and helps guide you. And they also help guide you after the course is over. There are group question and answer sessions, so you and the other parents in the course can learn from one another's questions and hear the Doman International staff's answers. And you get a private meeting at the end of the course with a Doman Method coach to help finalize your child's treatment plan. You get access to Doman International evaluations around the world and our future advanced courses. So after our online course, most parents will come to Doman International to have their child evaluated and assessed by our staff. And so coming to this first course gets you access to coming to one of our clinics around the world. So if you're thinking about signing up for our next online course, there are 3 bonuses for early enrollment in the course. And I like to make parents aware of this because it's a great reason to sign up early. So if you sign up 90 days in advance, 3 months before the course begins, you get 3 bonuses that add up to $559 in additional value. So the first thing is you get an immediate 30-minute consultation with the Doman Method staff coach to get started. So it might be 3 months before the course starts, but you get that 30-minute coaching session with the staff coach. And so they tell you how to get started with your program even before the course starts. So you get started, and that allows you to get some success under your belt even before the course begins. And along with that success, results with your child. Also, if you sign up 3 months in advance, you get free access to 3 advanced courses after graduating from the online course. So that includes, you get advanced courses in speech development, good nutrition, and sleep for your child. That's a $200 value. It's included in the bonuses. And the last thing is you get a free consultation and guidance to start the Doman Method oxygenation program once the child has been approved by a physician. And that is a $199 value. So if you sign up 90 days in advance, you get all 3 of those things. If you sign up 60 days in advance, 2 months in advance, you still get the 30-minute consultation with the staff coach, and you still get free access to the 3 advanced courses. That's $360 in additional value for signing up early. And then if you sign up 30 days in advance, 1 month in advance, you still get access to those 3 advanced courses in speech development, nutrition, and sleep. So whenever you sign up, as long as you sign up more than 1 month in advance, you get these bonuses. But obviously, the earlier you sign up, the more bonuses you can access. If you're interested in coming to Doman International for an evaluation, these are the typical locations where we host evaluations around the world. So, of course, our center in Philadelphia in the United States, that's where I'm located, but we also do evaluations in New Delhi, India, in Moscow, Russia, in Belgrade, Serbia, in Pisa, Italy, which is our second major hub, and then also in Latin America. In Latin America, it depends on each year and where our families are located in Latin America. For example, last year, we went to both Colombia and to Mexico. So it really depends on where the families are located in those locations. Most importantly, if you're just learning about the Doman Method now, never give up. Whether you choose to learn more about the Doman Method in the future, or you're going to try other treatments for your child, keep going. It's that resilience that you have that brought you even to watching this video. Keep going. You're the best thing that your child has, and never give up. Thank you to everyone for joining me for this 7th episode of Making Milestones. Next week, in episode 8, we're going to be talking about fundamentals of sleep for kids with special needs, how to help teach your child to sleep independently and through the night. Thanks everyone for joining me. Have a great week.